Other cities throughout the country have struggled with this issue, like the city of San Francisco, for example. The Golden Gate Bridge is a suicide icon in the city of San Francisco, just as the Vista Bridge and perhaps even to some degree the Fremont Bridge here in Portland. And not long ago, the city of San Francisco conducted a long-term study because so many people were jumping, and they asked the question, what can we do to have an impact on the number of people that are using this as a method of self-destruction? And they talked about a number of different things. Should we put up nets? The concern was if you put up nets, people will be inclined to think about it as if it'll plant a seed, when in fact the reality is that if people are thinking about suicide, that they're likely to take a step towards it. So one of the things that they found out was that there were, over a period of time, about 1,000 suicides from the Golden Gate Bridge. There were about 16 people who jumped and who survived. Now, not one of those 16 people swam to shore and attempted suicide again. In fact, in follow-up interviews, those people said that as soon as they left the bridge, they all said, I want to live, I want to live, I want to live. And so one of the programs that we've adopted in the Police Bureau and trained people in is a program called QPR. It's CPR, basically, for suicide. It's ask a question, save a life. If in our culture we think somebody's suicidal, we're inclined to just ask them, are you thinking about killing yourself? And then get the feedback, get the response. Sometimes they are, sometimes they're not. If they're not, they'll say, no, I would never kill myself. I've got a family, there's religious prohibitions, I would never hurt myself. Good, perfect, that's the answer we wanted to hear. But for people that are thinking about it, then we follow up and ask, have you thought about a method? And if they have, it indicates that they're even more serious about an act of self-destruction. So that's the question. The P, persuade, is we really don't want to see you hurt yourself. We don't want you to commit an act of destruction. We don't want you to die. We know that you're probably feeling a sense of hopelessness. There's some loss, maybe a major relationship crisis, loss of a job. There's usually some major dramatic crisis in life that brings a person to that kind of suicidal crisis. But when they get help, we know that they can often respond and recover. So that leads us to the R, refer. And refer is to help get our people or people out in the community to people that can help. And so that means their doctor, a mental health professional, or the resources that are available through Oregon Partnership. We hear every day about people committing an act of self-destruction in a whole host of different ways. It's all awful and it's all tragic. Fire and police, ambulance, we see it every day. We'd like to see it less. We'd like to get help to people. We'd like to intervene sooner. We'd like your help in delivering that message.